How are you? This video brings a very important warning because there are commonly used medications that many people start taking them and begin to notice their vision getting worse. This worsening can get more severe over time, even leading to blindness in some people. I'm going to tell you which medications you need to be extra careful with when taking. You need to watch this video, stay until the end because you won't want to miss it. Before we start, I want to ask you, have you ever noticed any changes in your vision, in your ability to see after you started taking any medication? If so, tell me here, which medication was it? I would love to see your comment. Remember to like the video, it helps me a lot. And share this video with those who need it. Let's expand this chain of kindness because that's what I want here on the channel. The first medication on our list is hydroxychloroquine. It's an essential medication for many people living with lupus, rheumatoid arthritis, autoimmune diseases, and it saves lives. But it has a serious side effect that few people know about. This medication can cause toxic retinopathy, which is damage to the cells of the macula, the region responsible for central vision, for reading, for recognizing faces, right? It's responsible for recognizing everything we see throughout our day. This damage ends up being irreversible. The symptoms take a while to appear, and by the time the patient notices there's a problem, the lesion is already established. The risk increases significantly when use exceeds 5 years, when the dose is higher than 2.3 milligrams per pound of body weight per day, and when the person has some kidney disease or is also taking tamoxifen. A warning sign for you to start paying attention is difficulty reading or wavy vision, or spots in the field in the center of your field of vision, right? In that very central part of your eye. Another medication on our list is corticosteroids, which are very powerful, right? We know they help with respiratory crises, autoimmune diseases, very strong allergies, and severe inflammation. But prolonged use can deeply affect the eyes. There are two main risks. The first is posterior subcapsular cataract, which usually appears earlier, and it progresses faster than a common cataract. And the second is corticosteroid-induced glaucoma, especially when used as eye drops, ointments, or near the eyes, or with very potent nasal sprays. This happens because corticosteroids alter the drainage system of the aqueous humor, increasing intraocular pressure. And this high pressure without symptoms is what leads to progressive vision loss. The warning signs in this case are blurred vision, halos around lights, and hidden pain. And the preventive measure is always to have your eye pressure checked regularly when you use corticosteroids, especially in eye drops. Another medication is Topiramate, which is widely used for migraines and epilepsy, and some people use it for weight loss because it reduces appetite. It also helps a bit with binge eating. It can cause one of the most dangerous conditions in ophthalmology, which is acute bilateral glaucoma. That's right, in both eyes. So, it's even worse. This can happen within days or even weeks after starting the treatment. And this mechanism involves swelling of the choroid and the lens shifting forward, closing the angle of the anterior chamber and causing a spike in eye pressure. In other words, glaucoma, right? Which is precisely this increase in intraocular pressure. The typical symptoms are intense pain, very blurry vision, red eyes and sensitivity to light, where the person sees halos around lights, nausea and vomiting. It's an emergency. The person needs to stop taking Topiramate immediately. And when they do that, the condition usually reverses. At least there's that. Another group of medications includes Mounjaro, Ozempic, and Wegovy. These are medications that help with weight control. And this is a question people have been asking me a lot because there are so many news stories in the media, right? And it's what causes the most confusion these days. These medications for diabetes and weight loss are used and they don't specifically cause blindness, but they can worsen pre-existing problems. This is a very important point for us to discuss, especially regarding the retina. Because when they lower glucose too quickly, especially in the first few months, people with diabetes already have more fragile blood vessels, and this can lead to a worsening of diabetic retinopathy, which the person already had, sometimes without even knowing it, microhemorrhages, and changes in ocular blood flow. So this isn't new. This already happened with insulin, with people living with diabetes who had very high blood glucose, and the control was very aggressive. But it ended up making the news because recent studies showed that users of semaglutide had a slightly higher incidence of this aggravated retinopathy, especially those who experienced very intense drops in blood glucose. Another point of caution, which is rare but should be monitored, is retinal vascular occlusion. Who is at risk? Of course, those who have had diabetes for a long time and have a long history of difficulty controlling the disease. Those who have already been diagnosed with retinopathy, so it's important for diabetics to have eye exams every year. Those who start treatment with very high glycated hemoglobin, those who are hypertensive, and those with chronic kidney disease. So before starting Mounjaro, Ozempic, or Wegovy, if you are diabetic, it's a good idea to get a retinal scan. And always reevaluate every 3 months to see how things are going so you have complete safety and control. Another medication on our list is those drugs for male sexual potency like Viagra, Cialis, and Levitra. They carry a silent vascular risk. This class is very popular for erectile dysfunction, but it also has well-documented effects on eye health. It can cause non-arteritic anterior ischemic optic neuropathy, meaning a sudden and potentially irreversible loss of vision, because these medications can alter the blood flow to the optic nerve, especially in people with some vascular predisposition. So, a person may experience bluish vision, light sensitivity, changes in color perception, and those at higher risk are diabetics, people with hypertension, and those with sleep apnea. And what about those who have already had this problem? If it happened in one eye, the problem can recur in the other eye. So, if your vision becomes blurry or suddenly darkens and you have taken this medication, it's very important to go to the ophthalmology emergency room immediately for evaluation and treatment. Before finishing, I just want to tell you that these medications are not necessarily bad for your eyes, but they can increase the risk of developing a health problem. So, if your doctor knows you personally and prescribed it, most likely they took your eye health into consideration beforehand. If you need to take these medications and feel unsure, ideally you should get an eye checkup before starting them, right? Measure your eye pressure, get a retinal mapping, and do any other complementary exams your doctor considers important so you can undergo your treatment with complete safety. Also remember that the health of our eyes is closely related to our diet. I have many videos here on the channel talking about the best and worst foods for vision and for eye function. I'll leave those videos down below in the description for you as well. Let me know if you've ever taken any of these medications and experienced any side effects with your vision, your eyes, or any other effects. Did it cause any discomfort? I would love to see your comment. Remember to like the video, it really helps me out. And share it with anyone who would enjoy it or who needs it. Let's expand this chain of kindness. That's what I want here with the channel. See you next time. Bye.